Today we are going to talk about statin side effects. So this is something that I talk about with my patients all the time. I really wanted to kind of frame this discussion in a way so that people could understand my perspective on this. And I'll say, this is my perspective. You know, I've been a physician over 25 years. I have specialized in preventive cardiology. I've prescribed statins for, I don't know, 10,000, 15, 20,000 people. I don't know how many that is. If you looked at all of the people I have interacted with who have been on statins, like, realize I worked at Mayo Clinic where there was, over 30 cardiologists in our group. I've been at, the University of Arizona, Banner University. I've worked with, dozens and dozens of cardiologists, all who prescribe statin medications. So I have a lot of experience about the statins. This is my perspective. Doesn't mean it's always the right one. I'm open to hearing what other people think, but I do base this on knowledge, firsthand knowledge, not, something I read in a, what was the thing we got sent recently, Rylan, 171 patient survey study. Yeah. This is the best science that is available and based on my real experience as well. So, take that for what it's worth. So let's get started on statins and what are statin side effects and are they bad for you? So this is one of the most common discussions that I have with my patients. And as I said before, I understand why people are cautious about that. Nobody wants to take a medication that causes side effects or doesn't provide benefits. But on the other hand, we don't want to miss an opportunity to improve our future health, of course, also, potentially avoid what is the leading cause of death and disability, and namely heart disease and stroke. And so balancing those, those issues are really what we're talking about here. What are the risks? What are the benefits? So, how do you make the best decision for statins for yourself? Well, number one, I would say get as clear as possible on your goals. What's most important to you? Is it that you want to do everything possible to avoid a future heart attack, stroke, and early death? So if that's the case, and that's what a lot of my patients, what the situation they're in, either they've had a heart attack or they've had a stent or they've had heart disease or they've seen firsthand in a family member or what the devastating effects of heart disease can have even at a very early age. And they have decided, I'm willing to do whatever it takes as long as it makes sense to me to avoid that if I can. That's a different goal than some people. I talk to some patients and their goal is to avoid all medications. They do not want to take medications, even if there's benefit to those medications. I understand that. Like, that's a completely reasonable goal if that's your goal. But if you understand that right up front, then that helps a lot in the decision process. And then the next part is where it gets a little bit more complicated, and that is understanding the benefits and risks of statin medications as best as you can for you. So as I'd also said, fortunately, statins are among the best studied medicines in the history of medicines. We've been prescribing medications since the 1980s. I was in high school in the 1980s. I mean, that was a long, long time ago. And over that time, this is one of the most prescribed medications in the world. So we have a ton of experience around statins. They've been around forever. Lots of people taking them. And there are people, even with all that evidence, there are still people out there that believe that statins are overprescribed, that they don't provide much benefit, that they have significant amount of risk. My perspective is a little bit different. The other extreme is you might have heard this, some people advocating we should put statins in the water, meaning that everybody should be taking a statin. I don't think either one of those are reasonable approaches. I think it's somewhere in the middle, that statins can be valuable tools for the right person to help them achieve their health goals. It's just maybe your goals may or may not be consistent with that. So, before we get into those perspectives, those risk benefits, I just want to, stop and take a step back and say, okay, what are statins? What are we talking about here? So statins are a short name for medications that lower cholesterol. The full name is HMG-CoA reductase inhibitors. You don't have to remember any of that, but we call them statins because each of these medications names end with statin. So the most prescribed ones are rosuvastatin, atorvastatin, simvastatin, pravastatin, lovastatin, pitavastatin, and fluvastatin, all end with statin. And so that's why we call them statins. So, as I mentioned, what are the risks? What are the benefits? I'm going to do a podcast in the near future about the benefits of statins, like really getting clear on what those are, because I think that's something that is not as clear in the general information that's out there. I want to do a deeper dive on that, but let me just summarize with the benefits here. Why would anybody want to take a statin medication? Well, the reason why is because we have mountains of research evidence and clinical experience that tells us that when high-risk people are prescribed or take a statin medication versus a placebo in a research study, the group that takes a statin has a lower risk of heart attacks, strokes, and death. So why do we take a statin, or why would anybody take a statin? It's not necessarily to lower cholesterol. I don't even like using that phrase. These are cholesterol medications. What they really are, what they're really prescribing for, or the reason people should be taking them is because they want to lower their risk of heart attacks, strokes, and death. And we have about 40 placebo-controlled randomized trials now in high-risk people that when we look at the group that took the statin versus the placebo, the group that took the statin had a lower risk of heart attacks, strokes, and death. That's been true in all high-risk populations that have been studied outside of two. And those groups are those who are on end-stage renal disease. So they're on dialysis for kidney failure. In a trial in that population, statins didn't change outcomes. And then in people with symptomatic heart failure, meaning that their heart muscle is weak and they have limitations, shortness of breath usually being the main limitation from heart failure, statins didn't improve outcomes in those trials. It doesn't mean that it's not a benefit for people that have those conditions. I just think that it means you need to talk with your doctor about that and see what the real risks and benefits are. So I would say if that doesn't make sense to you, if you're already out on this, you say, okay, well, I just don't believe that statins really have any benefit, then I agree with you if you decide not to take a statin. Like, why would anybody accept any risks at all if they don't believe there's any benefits to that? But if you say, okay, I think that I'm at least entertaining that idea that there may be benefits to statins, and those benefits are lowering my risk of heart attacks, strokes, and death, then the next question is, okay, what are the risks? And that's what we'll spend most of our time on today. So, like all medications, statins can cause side effects. And in most research trials, and I'd say this is consistent with my clinical experience as well, side effects occur in about 10% of people taking a statin medication. So that means 90% of people take the medicine with no adverse effects at all that they can tell. And far and away, the most common side effect from a statin is muscle aching, or, in medical terms, we call that myalgias. So muscle aching and myalgias, it's an interesting thing. A couple of things I'll just point out about that. Generally, if you're having muscle aching on, just isolated to one part of your body, like your left knee or something like that, I'd say generally that's probably not a statin. Usually the people that have statin associated muscle aching tends to be more all over, or, predominantly on both sides of the body. But again, if you have symptoms of concern, you should talk to your doctor first. This isn't me giving you medical advice. You need to talk to your doctor to decide if that is the case for you. But here's the interesting thing about muscle aching on statins. when people don't know if they're taking a statin or placebo, so they're just taking a pill, they don't know if it's a statin or placebo, the side effects are roughly the same for both of those. So I'll give you two examples of that from the research studies. So there's one meta-analysis where they looked at, meta-analysis means they took a bunch of studies that were similar and they combined the results of this. And this meta-analysis, they had studies that had over 129,000 people. So that's a really big, study in medicine. And what they found was that 13.3% of the people who were taking a statin stopped the medicine because of side effects. So 13.3%. However, in the group that was taking the placebo, 13.9% of people stopped the placebo because of side effects. So roughly about the same amount of side effects, depending on whether it was a placebo or whether it was on a statin. But another study more recently that I think was really clever, like a very elegant study to assess this, I think is really important and interesting to know. So what this study was is it's called an N of 1 design, meaning that each subject serves as their own control. And they took 60 people, so small numbers, but when you have everybody serving as their own control, you don't need the big numbers that you do in a typical placebo-controlled randomized trial. And they took 60 people that had stopped statins in the past because they were intolerant to them. They didn't feel good. Usually it was muscle aches, but it could have been other things as well. And they gave them a year's supply of medication. So they got 12 bottles of medication, or 12 bottles. 4 of the bottles had statins in them. 4 of the bottles had placebo in it, and 4 of the bottles had nothing in it. And they had everybody track their symptoms in an app. So every day they'd ask them, okay, are you having, muscle aches? Are you having whatever the symptoms could be related to the statins? But realize the person didn't know what they were taking. And actually the people doing the research didn't know what they were taking either. It was all blinded on both sides. What they found was that the group that was taking the placebo had about 90% of the side effects that the group taking the statin, or let me rephrase that. The people, when they were taking the placebo, had 90% of the side effects or symptoms as they had when they were taking the statin medication. So if you were taking no medicine, your symptoms were much lower. However, if you were taking any pill, whether it was placebo or statin, the rate of symptoms increased, and they were about the same, just a little bit less in the placebo than the statin. So the point of this is that whether muscle aches are really coming from the statins or due to the medication, or is it our mind's negative expectations? This is called the nocebo effect. So placebo, we all have heard about this. You give something, you tell people, think that it's like a pain medicine and their pain gets a lot better, even if it's a placebo. That's the placebo effect. The nocebo effect is doctor writes you a prescription and says, oh, this can cause muscle aches. Well, our mind is very powerful, and our mind could say, oh, you know what? Symptoms that you may not have paid attention to in the past, your mind might say, is that my statin? Is that being caused by my, my medication? And this is evidence that, in fact, there is a very powerful nocebo effect. And here's why this information is relevant. So, you might say, okay, well, whether it's nocebo or placebo or the medicine, if I ache and don't feel good, then it doesn't really matter. Here's why it may be relevant to this. In this study where they took these people that had not been able to take a statin in the past, had them on placebo or statin, tracked them over time, when they showed the people that their symptoms were the same, whether they were taking a placebo or the statin medication, about half of them decided to take the statin after that. So it is relevant. It is potentially relevant. I think it's something to keep in mind when you're trying to make that assessment. Are my symptoms related to my statin or not? So that's muscle aches, myalgias. Almost never are these life-threatening things. I mean, if you're having minor muscle aches on statin medications, it's rare that they would be causing a serious side effect. But what about the more worrisome causes, side effects of statins? And again, fortunately, we have a ton of data about this. We know a ton about this, like liver failure. So, you know, it's been an interesting thing to me over time that when I talk to a patient about a statin in the beginning, like they've never been on one before, and I say, you know, this is something you might consider, they'll know two things about it commonly. One is that the statins cause liver failure, and number two, they can't drink grapefruit juice on statins. There's a little bit of truth to both of those, but almost like those are so rare and such an infrequent thing. It's just interesting that people, you know, seem to gravitate and know that. But let's talk about liver failure from the beginning. So, or at the beginning. So liver inflammation, which is measured by blood tests to look at liver enzyme levels, can occur from statins, but it is exceedingly rare. I'd say in my 25 plus years as a physician, I've seen severe liver test abnormalities from a statin in less than 5 patients. So 5 patients out of, I don't know, 10,000, 15,000, whatever it's been. And in fact, the FDA about 10 years ago recommended to stop routinely checking liver tests for those people who are on statins because it's just so rare that it actually is relevant. The liver tests are almost always normal. So if there's not any signs of liver problems, the FDA is saying don't check liver enzyme tests. So what about the life-threatening muscle breakdown? That's called rhabdomyolysis. That's when this, you know, there's a severe breakdown of the muscle cells. This can lead to kidney failure and can be a life-threatening thing. That's also quite rare. I personally have never had a patient who's had rhabdomyolysis from a statin medication. I have seen it before in other colleagues' patients, but I will say that, you know, we saw this rarely in the past, and I just don't see it anymore. And I think it's likely because we're not prescribing as commonly the medications that interact with other drugs in a dangerous way. So, for example, it used to be simvastatin, which is the generic for Zocor. We used to use that at an 80 milligram a day dose. And when evidence came out that that drug can interact with other medications more commonly, particularly when it's at very high dosages, then we you know, those aren't used very much anymore. I think with that change, I just think rhabdomyolysis is exceedingly rare. I know it occurs. You don't have to send me any, you know, proof of that. I'm just telling you it's in a very, very rare thing. What about dementia or cognitive decline? I'd say this is one of the most common concerns my patients have about taking a statin. And I completely understand that. Like I've seen the devastating effects of cognitive impairment in my patients over years. And you know, I want to do everything I can as well to avoid dementia in the future. And we'll do a podcast on that because there's really a lot of power you have about avoiding or minimizing your risk for dementia. But the research evidence of statins does not show an increase in cognitive impairment. And in fact, shows a decrease in dementia. So I'm not saying the statins lower the risk of dementia, but I'm just saying in studies where we've looked at heart disease risk, and then later we looked and said, okay, well, what about dementia risk? The group that took the statin had less dementia than the group that did not take the statin. That being said, everybody's an individual. I do have patients who were convinced, and I believe them, that the statin led them to having issues with their thinking ability. They were foggy, that they weren't able to think as clearly, and when they stopped the statin, that got better. The challenge, of course, is how do you really assess that? How do you know it's actually the statin that's causing that or not the nocebo effect? I don't know. I don't know how we would assess that, but I would say in those patients, I would not take a statin if I felt like it was causing me cognitive decline. But if your concern is this going to lead to cognitive issues down the road? We have hundreds of thousands of research data patients show it, suggesting that is not the case. And in fact, maybe it's even protective. So what about causing diabetes? And it is true, the high strength statins like atorvastatin, rosuvastatins at high dose have been associated with a slight increase in the incidence of diabetes. But I think it's important to keep this in perspective. So, while high dose, high potency statins in some people can raise their blood sugar just a couple of points, then it can lead to them, if they're right on the verge of being diabetic, it can lead to them actually becoming diabetic. They cross that threshold level of pre-diabetes to diabetes. But here's what's really important to know about this. Number one, people with normal blood sugars do not develop diabetes from a statin medication. It's in some people, it can slightly increase blood sugars. In those people who are on the verge of becoming diabetic, what is their risk? What are they going to die of? What are they going to have a problem with? Heart disease, stroke. They're at very high risk for these conditions. Even though they're not quite diabetic, they're pre-diabetic, but their risk for heart disease and stroke is about the same as they have diabetes. Those are the people that are also going to benefit the most from the statins' protective effects. So, if that's a concern for you, if you are on the verge of becoming diabetic, I would say, one, you're at very high risk of heart disease and stroke likely. Number two, there are better ways likely to lower your risk of becoming diabetic. Nutrition, physical activity, sleep, stress, weight loss, those things have been proven to be effective in lowering the risk of becoming diabetic in the future. And then the last worrisome side effect I want to talk about with statins is kidney impairment. And this seems to be specific to rosuvastatin. And I'm more likely to minimize the dose of the rosuvastatin or choose another statin for my patients who are at high risk for kidney impairment. So I want to wrap this up with some more practical advice. Like, what do you do, or what to do if you have statin side effects? I want to start though with, although serious adverse effects from statins are rare, if you have them, stop the medicine and seek urgent medical attention if you have severe symptoms. I'm not your doctor. I can't be your doctor. I'm not giving medical advice. This is for general information purposes only. All those legal mumbo jumbo things that we have to throw out there. But I think it's important that you work with your doctor to make these decisions because they are critically important. So, while it's true that 90% of people can take a statin with no side effects, the truth is I've had a ton of experience with people who have had side effects from statins. When I worked at Mayo Clinic, I kind of half jokingly said I saw everyone in the Mayo system who couldn't take a statin because my colleagues would commonly send them to me for evaluation because they knew I was interested in, prevention and statins and things. And so I've met many people over time who were really desperate to take a statin. Like, they really believed in the benefits of the statin medication because they knew they were at really high risk for future heart disease, yet they just could not tolerate the side effects. So, what would be a reasonable approach? What did I do with these patients? Well, to help them make the best decision for themselves, I would try to answer these 5 questions. And I would work with your doctor to see if you can answer these 5 questions if you're having side effects or maybe side effects from a statin medication. So the first question is, do you really need a statin? That's where the understanding the risks and benefits come in. And if you're not at high risk for a heart attack or stroke, maybe a statin isn't the right choice for you, even if your cholesterol is higher than you'd like. Number 2, are your symptoms really coming from the statin? Recognize your mind is a powerful thing, and the nocebo effect is real. If you're unsure if your symptoms are indeed coming from the statin or not, work with your doctor to see if you can find a regimen that works for you. sometimes I would recommend to certain patients, once I knew that it wasn't a dangerous side effect that they were having, I would say, okay, why don't we stop it for a couple of weeks and then restart it again and see if the symptoms come back. That wasn't always perfect, but at least it would give them some ideas. Sometimes patients would say, you know what, I actually felt the same off the medicine, so I just went ahead and restarted it. Number three, is there something else going on? And this is really where working with your doctor is important. Sometimes there is something else that's causing the symptoms that's being attributed to the statin medications. Things like arthritis, autoimmune diseases, excess alcohol use, low thyroid, heavy exercise, vitamin D, low vitamin D levels. All of these have been associated with increased statin intolerance and should be evaluated with your physician. Number four, is a different statin or dosing schedule better for you? So just because you've had side effects on one statin doesn't mean others won't work for you. I have numerous examples of people that were not able to take one statin, but when we switched them, they were able to take that. Or maybe we tried different dosing schedules or other ways, or we lowered the dose of the medication. Under a doctor's supervision, statins are almost always safe. So work with your doctor and decide what's going to make the best sense for you. And then lastly, is there a better choice for you than a statin? We do have two other medications that have shown outcome benefit, meaning they've lowered the risk of heart attacks and stroke. In one of these, which is ezetimibe or Zetia, and in the other, the PCSK9 antibodies, which is Repatha and Praluent, those also have a mortality benefit to them. Are those better choices potentially for you and your health goals? That's where you talk to your doctor about. So again, wrapping up here, I believe statins can be a powerful tool to lower the risk of heart attack, stroke, and death for some people, not for everybody, but for some people. And whether that is you or not can only be decided between you and your doctor. And to take a statin or not should always be a personal choice. If you look at the evidence and determine a statin isn't right for you, then don't take it. I understand that. Like, that is your choice. Ultimately, you're the one who suffers the consequence or enjoys the benefit of the decision. Nobody else is. So work with your doctor, get the information from the best, most reputable sources that you can find that don't have bias. Of course, we all have some bias, but limit that bias as much as you can, and then make the decision that makes the most sense for you. I think that there are people on both sides of this. There are people that are taking statins that probably don't really need them. They aren't deriving much benefit. On the flip side of that, there are a lot of people that would benefit from the statin medications that are not taking it. And it's not because they have side effects, it's because of their concern or that perceived risk that is preventing them from achieving their health goals. So I hope this is helpful for people. I'd love to hear comments about this. 2 weeks now, we are going to be talking about another topic that is going to be controversial and of interest, I think, and that is funny. The segue wasn't quite good we were talking about lifestyle and medications, but we're going to talk about medications for weight loss. And the reason that we're going to talk about this, I've always been very cynical about weight loss medications because frankly, we've had some disasters in the past, like medications that cause heart problems. They don't work that well. They add a lot of side effects to them, but we now have a medication that's available, although hardly anybody can get it, but we have a medication that's available that has an average of 15% weight loss in about a year's time for the people that take that medication. And then the New England Journal of Medicine, the most prestigious medical journal in the world, published last week a new study on a medication that shows even more incredible results for weight loss. And these medications have been shown in other studies to have, really significant, quote unquote, side effects, like lowering the risk of heart disease and improving mortality. So this is an exciting time. I want to talk about these medications though in perspective, in context. Like, I think that, there's people over there saying, oh, well, weight loss medications never make sense because they're a temporary fix and they're a Band-Aid. I agree. If they're used alone, like, okay, here's the prescription, good luck to you. I don't think that makes sense. Like, they're very expensive, and I think they're missing the point. But if they're used in a comprehensive approach to improving health, lowering your risk of heart attack, strokes, and death, getting you the goals that you want and getting them faster, I think they can be really powerful tools in that. So we are going to talk about the new weight loss drugs and how they might be best used by you to achieve your health, weight, and longevity goals. So I look forward to everybody joining us in 2 weeks. And thank you, Rylan. Always a pleasure. And if you have any more comments, please leave them in the comment section, because we'll get to them down the road, even if you're watching this on replay. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching. And if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.